Doctor, the family insists on staying in the room.
Mrs. Rodriguez?
Yes, her cousin and her mother-in-law. I told them that we provide interpreters here at the clinic, but she's still a little unsure. It's just as well I'm very busy.
It says here that last week she was put on a 1,500-calorie diet plan for her diabetes and asked to follow up in 6 weeks.
Well, I think there's a problem.
Ella se siente mal. ¿Y dónde está el doctor?
Hello, I'm Dr. Royce.
Dile lo de la dieta. Venga.
Ay, pero no ahorita, yo no me siento bien.
Te lo estoy diciendo. Es la dieta. No sabía nada. Cualquier persona se sentiría mal comiendo eso.
Who speaks English?
I do. I'm Paulina, Lourdes' cousin, and this is Leticia, her mother-in-law.
All right, I need to get over here. All right, what can I do for you today?
Lourdes has been feeling dizzy and jumpy today.
Okay.
No es nada. Ella no tiene nada, solo nervios. Esa dieta pone nerviosa a cualquiera.
We think she's just nervous.
All right, any blackouts?
Blackouts?
Yes, has she ever passed out, became unconscious when she was dizzy?
¿Te has dormido cuando te dan esos mareos?
No, nunca. Pero yo ahorita me siento muy mal. Yo siento que me voy a desmayar. Y además siento como que el alma se me sale del cuerpo. Y luego las manos. Además dile que siento como hormigas en las manos. Y en los ojos, así como que me veo cosas enfrente de ellos. Ay. Y yo tengo mucho miedo de caerme y de que me vaya a lastimar. Yo tengo mucho miedo.
No, está bien. Está bien.
Mucho miedo.
Lourdes says no.
Is she sticking to her diet plan?
El doctor quiere saber si estás siguiendo la dieta.
Yo estoy tratando, pero es muy difícil comer así.
Esa comida, esa dieta no es buena. Y no me vas a decir que estás tan mala como no poder cocinar para tu familia.
No, pero...
José trabaja muy duro y tiene que comer bien.
Pero es que yo no me siento bien.
What's going on?
I don't think Lourdes is sticking to her diet, and Leticia doesn't like the diet.
Well, it's not for her, it's for Lourdes. Tell her that this diet plan has been scientifically proven to be beneficial to diabetics. Lourdes must stick to this diet plan if she wants to avoid complications that can develop from her diabetes.
¿Qué dice?
Complications such as kidney failure, loss of extremities, problems with her eyes, heart attacks, okay?
El doctor dice que tiene que seguir la dieta. Es muy importante. Si no lo hace, le va a dar un ataque al corazón o puede afectarle los ojos, le puede poner ciega o enfermarse de los riñones, le puede dar algo muy malo. Debe de seguir con la dieta.
Es que nosotros no estamos acostumbradas a comer esa clase de comida. Y yo no la voy a comprar. Lourdes necesita cocinar y comer buena comida. Enchiladas, tamales, tortillas, carne asada, salsa y fruta.
Is Lourdes eating those kind of foods, enchiladas and such?
Claro.
Those foods are not on her diet list.
I think she is anyhow. Jose, her husband, and her children, they like to eat traditional Mexican foods. And I think his mother has him kind of spoiled. I've been trying to stay away from that kind of food myself because of the high fat. I'm trying to lose some weight.
All right. Lourdes cannot eat the traditional Mexican foods.
¿Qué dice?
If she gets sick, it's going to be your fault.
¿Qué dice?
Si Lourdes se pone mal, es su culpa.
¿Qué?
All right, would you ask her to leave the room? I would like to speak to Lourdes without her in the room.
Quiere que espere afuera. Quiere hablar a solas con Lourdes.
Este diabetes es la voluntad de Dios y nosotras no podemos hacer nada.
Leticia says that the diabetes is God's will.
Well, it doesn't matter. Lourdes still needs to stick to the treatment plan.
A él no le importa a Dios.
¿Qué?
Ella tiene que comer las comidas de la dieta.
Pues es la voluntad de Dios.
Now, I want you to tell Lourdes that she must stick to this treatment plan. This is very important, all right? Regardless of what her mother-in-law wants, you see, Lourdes has type 2 diabetes. This occurs when the body cells have become resistant to insulin. This reduces the amount of glucose that can be used by these cells at any one time. Lourdes must get her blood sugar under control and keep it there.
El doctor dice que tiene que seguir con el tratamiento. Es muy importante. Tu familia está equivocada. El doctor sabe lo que hace. La glucosa no es suficiente. Dice que estás comiendo mucho azúcar. Que no comas tanta azúcar.
Perdón, doctor. Yo ya sabía que se iba a enojar.
Tell her that her dizzy spells are the result of her not following her diet plan.
Dice que con solo comer algunas cosas en la lista, ya no te van a dar esos mareos.
¿Sabes qué? Dile que me dé una lista de la dieta en español, porque en mi diccionario que tengo en la casa no aparecen las palabras de la otra dieta.
No, estuvo bueno por ahora. Mejor no molestarle al doctor.
Everything okay?
Ya.
All right. Go ahead and make a follow-up appointment in 6 weeks from now, all right? Okay, good.
Doctor, the family insists on staying in the room.
Mrs. Rodriguez?
Yes, her cousin and her mother-in-law. I told them that Kaiser provides interpreters here at the clinic, but they're still very unsure. It's just as well I'm very busy.
All right, but I still want you to interpret.
Okay.
Is it possible to see Mrs. Rodriguez alone?
It is, but you need to understand that when Mrs. Rodriguez brings her family in, it's a cultural thing. It's important for all of the family members to hear what you have to say. Oh, also, the mother-in-law needs to be included in any of the decision-making and convinced of any treatment plan, or it may not happen.
Thank you. It says here last week she was put on a 1,500 calorie diet plan for her diabetes and asked to follow up in 6 weeks.
Well, I think there's a problem.
She seemed to be fine with the treatment plan.
Oh, don't be so sure. You see, sometimes Latinos, they have a difficult time saying no. They feel they're going to be insulting the physician's expertise.
So, we need to make sure that they really agree with the treatment plan and they're not just being polite.
Exactly.
All right. If Mrs. Rodriguez is having trouble following the treatment plan, we need to find out why and try to get her back on the plan.
Okay.
Also, go ahead and ask any questions that you feel are necessary.
Okay.
Great.
Más de 45 minutos ya. ¿Pero qué es eso? ¿Qué clase de citas son esas?
Hola. I'm Dr. Joyce.
Ella es la doctora Joyce.
Yo soy Lourdes Rodríguez.
Soy Leticia Rodríguez. Mucho
Paulina.
gusto.
You've already met Mrs. Martinez. She's going to help us with the interpretation.
Ustedes ya me conocen, soy la señora Martínez, voy a ser su intérprete.
Dile lo de la dieta.
Ay, no, ahorita no. Si yo me siento muy mal.
Te lo estoy diciendo. Es la dieta. No sabía nada. Cualquiera se siente mal comiendo esa comida.
I sense there is a problem here.
Siento que hay un problema aquí.
Sí.
All right. I'll sit down and then we'll see if we can help you with the problem.
Bueno, vamos a ver cómo podemos ayudarla.
Okay.
Now, what's going on today?
Ahora, ¿qué está pasando?
Es que yo me siento muy nerviosa y estoy como muy mareada.
Lourdes says that she feels jumpy in her body and dizzy.
Lourdes no tiene nada. Es solo nervios. Que cualquiera se pondría nerviosa con esa dieta.
Leticia said that there's not much going on with Lourdes, that she's having an attack of the nervios, and it's the diet that's making her nervous.
I understand your concern for your daughter-in-law, and I understand nervios.
Dice que entiende su preocupación por su nuera y también entiende la razón por sus nervios.
Many times people with diabetes feel weak or dizzy. They don't have enough energy.
Muchas veces la gente con diabetes se siente débil o mareada, no tienen mucha energía.
It could be that Lourdes is having some of these feelings now. Do you think that might be possible?
Puede ser que Lourdes está sintiendo estos síntomas ahorita. ¿Puede ser eso?
A lo mejor, no sé.
Maybe, I don't know.
Are you worried about your diabetes?
¿Está preocupada por su diabetes?
Correct me if I'm wrong, but I sense there's a problem with the diet plan that you got at your last visit.
Dígame si estoy equivocada, pero ¿hay algún problema con la dieta que le dieron en su última visita?
Sí.
Sí, sí. Yo estuve todo el tiempo tratando de seguirla, pero es que es muy difícil comer esas comidas.
Lourdes says she has been trying very hard, but it is very difficult to eat those foods.
Esa dieta no es buena.
That diet is no good.
What do you mean by no good?
¿Qué quiere decir con eso?
Que no tiene sabor. Y además no es la clase de comida que nosotros estamos acostumbrados a comer.
Leticia says that the food has no taste and it's not the type of food her family is used to eating. ¿Qué tipo de comida come su familia?
Comemos comida buena, enchiladas, carne asada, tamales, tortillas, salsa y frutas.
Leticia said that her family eats good foods. Tamales, enchiladas, tortillas, frutas, salsa.
I see. Oh, this is in English. Would you like to have a diet sheet in Spanish?
Dice que la lista está en inglés. ¿Quisiera una lista en español?
Can I say something?
Oh, yes, of course.
Lourdes, her husband Jose, and their children like to eat traditional Mexican foods. I think his mother has him a little spoiled. I myself have been trying to avoid those kinds of foods because they're so high in fat. I've been trying to lose some weight.
Well, thank you for that. I understand that most of these foods are not the kinds of foods that your family is used to eating.
Entiendo que muchas de estas comidas no son las comidas que su familia está acostumbrada a comer.
I also understand that your family needs to have good foods to keep them strong and healthy.
Y también entiendo que su familia necesita buena comida para mantenerse saludables y fuertes.
All right. I think I can help by making some changes to the diet plan. Also, I think your family can help yourselves by trying to understand Lourdes' diabetes and her dizzy spells.
Creo que puedo ayudarles cambiando la lista de la comida y también su familia necesita ayudar para entenderlos, ayudar tratando de entender tu diabetes y por qué se marea.
Yo comprendo que este diabetes es la voluntad de Dios.
Leticia says that Lourdes' diabetes is the will of God.
I understand. Isn't it also God's will that He helps those who help themselves?
¿Que no también es la voluntad de Dios que Dios ayuda a los que se ayudan a sí mismos?
Es la voluntad de Dios.
Yes, it is God's will.
Good. Now, some of the foods that you mentioned are very good.
Algunas de las comidas que mencionó son muy buenas.
The salsa, corn tortillas, and of course the fruit.
La salsa, las tortillas y la fruta.
I feel we just need to adjust the way some of the other foods are prepared so that Lourdes is able to eat them. In this way, Lourdes' diabetes can be better managed.
Siento que necesitamos preparar las comidas un poquito diferente y así el diabetes de Lourdes puede ser mejor controlado.
So, I'm going to get some help from our health educator or our dietitian here at Kaiser, who is more familiar with the kinds of foods you like to eat.
Voy a preguntar ayuda de nuestro educador de salud o de nuestro dietista de aquí de Kaiser para que les ayude a hacer la lista de comida que puede comer.
Also, I'd like to get some help from you, Mrs. Rodriguez, in working out a new plan.
Y también quisiera su ayuda, señora Rodríguez, para hacer una lista de dieta mejor.
Because I bet you are a very good cook and could make these changes easily.
Porque sé que debe de ser una buena cocinera y puede hacer estos cambios muy fácil.
A ver si un día le cocino para usted, doctora.
Leticia says that maybe she'll cook for you someday.
Oh, well, good. I feel if we work together to help Lourdes stay on her treatment plan, then she won't have to worry so much about these dizzy and jumpy feelings she's been having.
Siento que si trabajamos juntos podemos ayudar a Lourdes que coma mejor y así no se va a sentir tan mareada. Y
I'd like you to make an appointment for 1 month from now.
quisiera que haga una cita de 30 días desde hoy.
And Mrs. Martinez will see that you get that diet sheet in Spanish.
Y yo me encargaré de que le den la lista en español.
Ay, gracias.
Qué bien, gracias. Muchas gracias, doctora.
Is there anything else that I could help you with today?
¿Hay algo más que les pueda ayudar?
Very good. Well, thank you for coming in.
Muchas gracias por venir.
Dile que gracias a ella.
Sí, al fin.
Adiós.
Adiós. Al fin encontramos
Ahorita
una
les traigo
doctora.
la lista.
Ah, muy bien, gracias.
Gracias.
Esta doctora sí que comprende diabetes, ¿no?
Baby, go ahead. Move your car right away because you're in ambulance parking. Show your face, your car right away.
Okay, yeah, I know. Okay, just go inside. I'll be right in there, okay? Hey.
The computers are down.
I'll check it out.
Help! I need a doc. I am sick.
You're sick.
No! Help! Somebody help me, please!
Looks like we have another one. What's going on out here?
I need some help.
All right, let me give you a hand. Down over here. Have you been...
What have you got, John?
I don't know, Doctor. This young man was out here screaming. Thought he was with a gunshot.
I'm Dr. Stewart. What's your name, son?
Ned Gwynn.
I think I've seen him here before.
What's the problem, Mr. Gwen?
It hurts.
Where does it hurt?
All over.
You're holding your stomach. Does your stomach hurt?
Yes. Arms, legs. I need Demerol for the pain.
Demerol.
I should have known.
I have sickle cell.
Sickle cell?
You have sickle cell?
Do you have your sickle cell form?
Forms, cards.
Mr. Gwen, if you have sickle cell, we'll take care of you.
This is a member card. Where's your sickle cell form?
I don't know.
I don't want to give him any Demerol. I'm going to take him in the back and give him 5 milligrams of morphine.
Go ahead.
No, don't take me in the back. I just need Demerol.
But they come through here all the time dressed just like him. Either looking for drugs or wanting us to take a bullet out.
But go ahead and check his card out.
Can't. Computer's down.
Please, give me something for the pain.
Should I call detox?
Mr. Gwen, I want to help you, but we need to check your card, and our computers are down.
Just give me the Demerol.
Look, we can't just give out drugs to anyone who walks in.
Give me the goddamn Demerol.
Take it easy. It's all right. Hey. I'm getting security.
Mr. Gwen, have you ever gone through detox?
No.
We can begin the process now.
Are you all right?
Are you related to Mr. Gwen?
I'm his girlfriend.
Your boyfriend needs some help.
He just needs some Demerol.
Yes, I know.
So give him some.
It's not that simple.
What's the matter with you? Can't you see he's in pain? Give him the Demerol.
He says he has sickle cell.
He does. That's why he needs the Demerol.
Well, where's his sickle cell form?
In his wallet. He had his form.
He gave us a member card, but our computers are down. When they come back up, I'll be able to check his card.
Dr. Stewart, we need you in Trauma 1.
Please, just give him the Demerol this one time.
I need to check his card.
He does have sickle cell, honest.
Look, I'm sorry, but we have a policy about giving out drugs.
All right, he's a drug addict then. Is that what you want to hear? Now give him something for the pain.
Has Ned ever gone through detox?
Is it because he's black?
Black?
Oh, he's young, black. He must be on drugs.
I never said that.
That's what you were thinking.
Look, I have no proof that your boyfriend has sickle cell. I don't care what color he is.
Come on. It's all right. I'll take care of you.
Can you please wait? Look, I'm sorry. I'd really like to help.
Dr. Stewart, security's here. Dr. Stewart, we need you in Trauma 1 now.
I'm coming.
I have asked Eve Lawson, a health educator, to come and tell you how to best manage Susan's asthma. She will be working with me on your case.
Susan's case, you mean?
Yes. At your last visit, I told you that Susan must use her inhaler regularly. There are no exceptions to this.
Susan's doing the best she can, aren't you, dear?
I'm trying. It is not good enough. This baseball game that she has been playing is making her attacks worse.
It's not baseball. It's softball.
Yes. Susan must learn how to manage her asthma in order to continue playing that game.
Daddy, do I have to stop playing softball?
Well, we'll see.
No, you certainly do not. Dr. Amapour, Susan loves sports. She's learning teamwork and discipline. I played sports when I was her age, and it was wonderful.
But you did not have asthma.
Can you believe this?
No. What about the cat? Did you move the cat outside?
We tried to move the cat outside, but Susan can't sleep without him.
You cannot have a cat in the house.
Daddy, do we have to get rid of Jake?
Well,
Jake stays in the house.
How can I help you if you will not listen to what I am saying?
Doctor, you're not listening to what I'm saying.
I am trying to help Susan.
Why don't you try talking to Susan for a change?
What about the cigarettes? Are you still smoking, Mrs. Mann?
I smoke outside, not in the house.
You must stop smoking cigarettes now.
Must? We're here for Susan, Doctor, not me.
Mr. Mann, do you understand what I am trying to say to your wife? Susan must learn to manage her asthma. She cannot be around cigarettes, she cannot have a cat in the house, and she must learn how to use her inhaler in order to play that game.
Well, I've been thinking about
Harry, sit down. Look, Dr. Amapour, Susan is not going to stop playing softball, and that is final.
That is not what I am saying. Susan can play the game if she does not play too hard, and she uses her inhaler the way she is supposed to.
Not play hard? That's a laugh. You have to play hard. You play the game to win. That's the way Americans train their kids. You never catch a daughter of mine in right field.
Mrs. Mann, children with asthma cannot be like that.
Where did you say you were from? Iraq?
Iran, Persia.
That explains it. I don't even understand you.
I don't understand you.
You're a very rude and cold doctor.
Mrs. Mann, you are a very difficult person to talk to.
I'm difficult. Can you believe this? I'm tired of talking about this with you. Where's that health educator?
She should be here any moment now.
Is she an American? I hope so. I don't think you can appreciate where I'm coming from because you're an Iraqian.
Mrs. Mann, I think it does not matter that I am Iranian.
Daddy, am I going to get an American doctor?
Ask your mother.
You bet you are, dear.
Dr. Amirpour.
Mrs. Lawson, I am glad you are here. This is Mr. and Mrs. Mann and their daughter Susan. Mrs. Lawson will explain to you the importance of managing your daughter's asthma.
Thank God, an American.
Mr. and Mrs. Mann, would you and Susan like to come into my office for a moment?
Gladly.
Mr. Mann,
Yes.
you seem reasonable. Would you talk to your wife?
Well, I'd certainly try. Right behind you, dear.
Sierra, what was all the commotion?
Oh, hi, Paul. Cindy.
Sierra, are you all right? Let's go to the staff lounge so we can talk about it.
Yeah.
Do you want to tell us what happened?
It is that Mrs. Mann. She thinks that because I was not born in America that I am not a good doctor.
She said that?
She thinks that. She also says that I am rude and cold.
Again? I mean, wasn't it just last week that you were telling me about a patient who complained that you were rude?
Mrs. Mann is the one who is rude. She is some sort of fanatic pushing her daughter into sports.
I know the case. Asthma. I treated her daughter last year. Very frustrating. The mother smokes. They have a cat in the house. Mrs. Mann can be very defensive.
I know the feeling. I've had difficulty with some of my patients, too. I've been called an orderly, a janitor, even worse if you know what I mean. But I'm not as easily offended as I used to be.
Why not?
Well, I started working on my communication skills, attending different educational programs that were made available to our department. Those programs have made a big difference with me. They've helped me see how patients perceive me. And Sierra, if you don't mind me saying, you can appear to come across a bit rude sometimes, abrupt. Now, I know that it's not intentional, but to be honest, I felt it myself. It's not so much what you say, but how you say it. And I'm sure that Mrs. Mann is a special case, but, well, what do you think?
I think that she does not like me because I am Iranian.
Wow. Too bad about Dr. Amirpour.
What do you mean?
Well, she seems to have a lot of trouble with her patients.
Paul, do you know what Dr. Amirpour did last weekend? What she did on her own time?
No, what did she do?
She bought stuffed animals, lots of them. And she then took them over to the children's hospital.
Wow. That's wonderful.
It's not the first time either. Dr. Amirpour is really a very sweet person.
It's too bad her patients don't know that.
All right.
Let's see what we've got here.
Great. Everything looks all right there.
Feels tired. Sometimes there's this bad feeling that goes up and down in here.
Sounds good. All right, I want you to take a deep breath for me. Once again. Okay, once again, deep breath. Good, good. Sounds good. Now, well, this is your third visit this month, eh, Mrs. Tran? Stomach problems, chest pain, then insomnia. Now, stomach problems again?
It hurts.
All right, lie back. Take a look what's going on with your stomach. Does it hurt here?
Yes.
What about here?
Yes.
What about?
Yes.
All right. Here, why don't you sit up and talk? Go ahead and put your clothes back on, and when you're finished, I'll come back in and we'll talk. Mrs. Tran, everything looks fine.
It hurts.
All right. Why don't you tell me about these stomach problems? When did they start?
I don't know.
You don't know.
No.
Any nausea, diarrhea?
No. Just tired.
Well, it sounds like you might be getting that stomach flu that's going around.
No, it's not the flu. It's parasites.
Parasites?
Yes.
Mrs. Tran, who told you that you have parasites?
I know what parasites are.
Have you had them before? Well, Mrs. Tran, I don't think you have parasites. Well, we don't have a problem with parasites here in the United States. Now, I'm going to give you something for those stomach pains. I think you should get a flu shot.
I had parasites when I was younger.
Are you sure?
I got dysentery in the camp. I was treated for parasites.
A refugee camp?
They treated us so badly. And me, so bad. We had no place to go.
Yes, you did. Your family came here to America, right?
Only those that lived. My mother. My brother. And now both of my children. My son went away to college last year. And my daughter, she's going away to school too.
Mrs. Tran, I don't begin to understand, but it sounds you had some really rough times in the past. But you're in America now. Don't worry about those days. Now, I don't think you have parasites. But if it's this upsetting to you, I'm going to go ahead and check for them. All right? I'm going to need a stool sample to check for parasites.
Stool?
Well, the nurse will be in to explain the procedure. Anything else today? Don't forget to think about that flu shot. I'll see you later.
Johnson is Dr. Lutz. May I come in?
Yes.
Hello, Mr. Johnson. How are you today?
Fine.
Thank you for coming in.
Sure. Your nurse called me and told me that my test results were back and I should be prepared for that examination that we talked about.
That's right.
She gave me this gown to put on, but I can't get it to tie in the back.
That's all right. I'm sorry, Mr. Johnson, but you won't be wearing it very long. The examination is pretty quick.
Right.
Your PSA results came back slightly elevated.
Uh-huh.
So I think we should do that digital examination that we discussed.
Oh, well, I don't know about this.
I'm sorry, what was that?
This examination,
Mr. Johnson, you remember we talked about having this examination if your PSA results came back elevated?
Yes, I remember, but I also kind of...
Well, they came back slightly elevated, and I don't think we should put this off.
Whoa, wait a minute. Are you saying that I could have it, prostate cancer?
No, I'm not saying that. What I am saying is that we should do everything to make sure everything is all right. Should I explain the examination to you again?
No, that's not necessary.
Are you worried about the test results?
Look, you know, I didn't even want to take this test, this PSA test. I mean, you talked me into it. I came in for my high blood pressure.
Well, it's a good thing that you did, Mr. Johnson. Your hypertension is under control now, but you're 56 years old, and you have not had a prostate exam yet.
Yeah, but you told me that this test, this PSA test, would be the last test I'd need.
If the results were normal, but yours was slightly elevated. Now, Mr. Johnson, this is a routine examination, and you won't feel a thing.
Yeah, right.
I've done hundreds of them.
Look, you know, I really got to be getting back to work now.
Well, it'll be over in a moment.
I'm not having any surgery.
We're nowhere near talking about surgery.
And I don't want to take any drugs either, because I'm still very active, you know?
Well, of course you are. Do you mean sexually?
Oh, God, I can't even believe I'm having this conversation with you.
Mr. Johnson, does it bother you that I'm a female doctor?
Look, doctor, you know, I knew this guy who took some vitamins one time for this sort of thing, and then he was fine the last time I heard.
This is the best test that we know of.
Oh, wow, look at the time. I really got it.
Now, we want to be sure, don't we? If we catch it early, there's a chance that you can live a long and fruitful life.
Fruitful?
It'll be all over in a moment.
Look, Doc, I really gotta go. I gotta get back to work. I just remember I got a very important meeting to attend to. Look, here's your gown. I don't need it. Thanks a lot. You have a good day. I'll see you. Bye.
Don't leave yet.
Jason? Hello, Jason.
Hi, Dr. Fleck.
Haven't seen you in a while. How are things going?
Fine.
How's high school football team? Still playing?
Yeah.
Any more problem with your shoulder?
Nah, it isn't bothering me.
Good. So I understand you're having some sort of problem with your groin.
Yeah, well, that's what I told the nurse. Actually, it's some stuff coming out, and I didn't know what to do.
So you're having some discharge from your penis?
Yeah.
Well, you did the right thing by coming in, Jason.
Okay.
So how long have you had this discharge?
It started a few days ago.
And have you been sexually active lately?
Well, I'm very careful. I know about the AIDS, the HIV and stuff. And can I ask you something, Dr. Fleck?
Of course.
I was hoping that you wouldn't tell my parents I came here today. I know you see them from time to time.
Jason, this is just between you and me. Anything we talk about in here is private. Your medical records or any tests that we decide to do are completely confidential.
Thanks.
Now, to begin with, I need to get a little more information. A few things about your sexual history, what you've done sexually. Would that be all right with you?
Shit, I'm sorry. I didn't know I have to go through this today. I thought I could just get a shot or something. Are you sure everything is a secret?
Jason, I won't tell anyone. You have my word. And I think you know that a shot is probably not the best form of treatment. Don't you think we should talk about this a little?
I don't know, maybe.
Jason, I'm here for you. I'm your family doctor and I want to help you.
I know. Yeah, I had sex.
Did you practice safer sex? Do you know what that is?
Yeah, you mean condoms?
Yes, that's one form of safer sex.
I know I should have. I just didn't have a chance.
Is this a regular partner?
Yeah. I mean, no. I mean, I sure hope we keep everything a secret. You know what I mean?
I'm not sure, Jason. Why don't you go ahead and tell me?
Everything. The test, and me coming here today. You know, I don't want to hurt anyone. You know, I don't want to shock them. I don't want them to hate me. The guys, coach, my dad. Look, Dr. Fleck, I need you to know I'm not some sort of... I mean, he was just someone I met.
Okay. Was it a man or a woman?
It's another guy.
It's okay, Jason. I understand.
It's just that the guys on the team are pretty rough on guys like that. You know, guys that are different. Everyone looks at them weird, calls them names or whatever. Homos, fags, queers. I don't think they understand their point of view. They're just different.
That's right.
There's just one guy at school that's different. He got beat up. Some guys beat him up after a game one night. He didn't come back to school for 2 weeks. I think he's dropping out of school. I think he lives with his aunt because his dad threw him out of the house. I don't know. I don't need this. I got plans. No one else knows. Now you know, but I mean, I like girls, all right, just not like that. You know what I mean?
Yes.
I mean, girls are always asking me out when the teaming happens. There's this one girl. I'll probably take her to prom because, well, it's a tradition, and my mom's always talking about prom and your date and how it's traditional, and I know she'd like that. I don't know. I just feel like I can't talk to anyone. My friends on the team are all straight. So I went to this bookstore. That's where I met Paul, this guy. And he goes to college, and so I went over to his place. I haven't seen him in a while, though, since we, you know. But it was just a few times. Dr. Fleck, I wish I didn't have to be like this. I just don't fit in. I mean, I don't think I ever thought, oh, I think the gay life is fun. I think I'll be gay. I mean, if being gay is a choice, then why would I choose it? Is there anything you can do to change me? Just make me like my dad, like Coach, like the other guys at school. Shit, sometimes I feel life isn't even worth living.
Jason, you sound very frustrated. I can hear the disappointment and the sadness in your voice, and I can see that you feel hurt and confused about a lot of things that are going on with you right now and at your school.
Yeah.
And I'm very sorry about that. But I do believe that with time and some help, you'll start to feel a lot better and you'll see that life is well worth living.
I don't know, maybe.
What you're going through right now, Jason, doesn't only pertain to people who are gay, but to any young person who's discovering something profound about themselves. Unfortunately, where sexual orientation is the issue, do you know what that is? well, where sexual orientation is the issue. Society has a long way to go, and change doesn't happen as quickly as we would like. It must be very difficult for you being with your friends and your teammates when they act the way they do toward other people just because they're different.
Yeah, it feels like they're cutting me down.
Sorry about that. Jason, I want you to feel safe and know that you can talk to me about any issues that you have. Jason, you have a few issues to deal with, but I want to help you.
Thanks.
But first, we need to address the condition that brought you in here today. And to do that, I need to get a little more information. Would it be all right with you if we talked a little more about what you've done sexually?
All right.
Thank you. I know you mentioned that you met this man, Paul, in a bookstore.
Yeah.
And you mentioned that you haven't seen him in a while. Can you tell me how long your relationship with Paul lasted?
A few weeks, that's all.
And what did you do sexually? Was there oral sex or anal sex or other things?
Yeah, just oral and anal.
Okay. And have you had a sexual relationship with anyone else within the last year, male or female?
A friend and I fooled around, but nothing serious. Then Paul.
What does nothing serious mean?
You know, sort of played with each other and masturbated, I guess. And didn't do anything else besides kissing.
Okay. Well, this helps me to put things into perspective, Jason. I appreciate you being open with me. And again, everything we talk about here today is completely confidential.
Thanks.
A little later, I'd like to talk to you about other forms of safer sex. But remember, no contact without a condom, okay?
Okay.
Good. Now I feel we should get started on those tests and see where we are.
All right. I just hope I don't have HIV.
Well, there are many potential reasons for penis discharge, so let's not think the worst, okay?
Okay.
First, I'd like to test you for the most common things that cause penis discharge. And then we'll see the results for all the tests, including the HIV test.
All right.
Good. Now I would like to address some of the other concerns that you told me about in confidence today. Have you had a hard time sleeping lately, Jason?
Yeah, it's hard to get to sleep at night. I just can't stop thinking about this.
Must make you feel tired a lot, huh?
Mm-hmm.
And do you find yourself crying when you're alone sometimes?
Yeah, but don't tell anybody.
Jason, you know that I won't. I am concerned that you sometimes think that life isn't worth living. Do you feel strongly about that?
I don't know.
Have you ever thought about taking your own life? Or thought about running away?
Sure, but I guess not really.
All right. What about thoughts of hurting yourself or others, your parents, your friends?
Not others. Myself, yeah. But I feel better after talking with you.
Good. As your family doctor, I want you to feel that you can see me and talk to me about any issues that you have.
Thanks.
You're not alone, Jason. There are a lot of teenagers and adults who are dealing with what you're dealing with now. For a short time, they may feel stressed or depressed. And I think that you might be experiencing some depression now. I'd like to give you a name of a group that helps teens when they're dealing with these issues. Also, I'd really like you to see someone on our staff who can help you with those feelings. We have some great doctors and health educators who have a lot of experience with those issues and concerns. I think they'd be very helpful to you now and in the future.
About being gay?
Yes, and some of the issues associated with being gay that have been troubling you lately.
Okay.
Thank you for opening up and sharing your innermost feelings. I think that in time you'll start to feel a lot better about what's been going on with you.
Thanks, Dr. Fleck.
What do you say we get started on those tests?
Okay.
Morning, Sandy.
Good morning, Doctor.
How are you?
I'm great. How are you?
I'm good, thanks. Have a great day today.
You too.
They do. It's very nice. Yeah. I'm new here, and I'm pretty sure I'm pregnant.
And we requested a female obstetrician, and they assigned us to you.
Okay. We'll do a blood test to make sure. And if so, congratulations, Donna. You and your husband or boyfriend must be very happy.
I'm Donna's partner.
Oh. I thought Alice was your sister or a friend. I'm really sorry.
Dr. Waver, what we need are some assurances that Donna and I will not be treated like a couple of lepers during our pregnancy.
Friends of ours who are also lesbian had a very bad experience here, and we don't want it repeated with us. What I want is a guarantee that Alice will be in the room with me when I deliver.
And not just that. I want the same unlimited visiting hours that any father would get, not just those general visiting hours.
And I want Alice's name to be on the birth certificate along with mine.
When our friends had their baby, only the biological mother's name could be on it.
Oh, and Alice needs to have durable power in case something happens to me.
Have you discussed any of this with a lawyer?
We need a lawyer?
I was thinking about the birth certificate and the durable power. I'm actually not sure about the legalities involved.
This is getting us nowhere.
Alice, I don't feel it would be a problem for you to visit Donna.
Visit?
Doctor, we may not be what you're used to, but we are co-parents. And our home is as suitable as anybody else's for children to be raised, cared for, and loved.
When our friend's daughter was born, the newspaper would only list the birth mother's name in the birth announcement.
And when they started seeing a pediatrician, they had to tell their story all over again.
I'm sure everything will be fine, just like any other typical pregnancy.
Well, that's just it, Doctor. Our situation isn't typical.
Our friends thought everything would be fine.
Let me see if I have this, Mrs. Yao. You and your mother say that a traditional Hmong birth would be private with only the husband nearby to help if needed. But here, you may do it differently and have some people in the room praying and chanting over bowls of sacred water. And if it's a difficult labor, a shaman might come into the room as well. Also, you don't want any anesthesia or cesarean section, and you don't want to lie on your back on the table. Instead, squat on the floor, deliver the baby into your hands, not letting it touch the floor. Is that correct?
Yes.
What is your mother saying now?
It's nothing.
Doctor, my English not so good. It is the Hmong way. Young people bad here in America.
Young people are bad in America?
She's upset with me because I'm not sure about all these practices.
I see.
My mother and my father and the elders are not so happy here in America. They say that the young ones of our people are learning behavior that is different from their own teachings. No.
Yes.
This is most important, Doctor. After the baby is born, could we please take the baby's placenta home?
You want to take the placenta with you when you leave the hospital?
It's very important to the Hmong. My mother's and father's placentas are buried in Laos, where their house is.
Buried?
In the ground in the house.
Inside the house?
The floors are dirt.
Oh.
You see, the placenta is the jacket, the first and finest garment we have worn. When we die, our soul puts the placenta on, and then we're able to reunite with our ancestors.
Well, you don't live in a house with dirt floors now, right?
No, we have carpet, and we live on the second floor, but we will bury it close by.
I don't believe I could let you take it home with you. We have to consider the health risks.
Oh, but it is the Hmong way.
It's okay. Please don't cry, Na. My mother doesn't know if her house is still standing in Laos. She's worried that they will not be able to find their placentas when they die. If the soul cannot find the placenta, they will wander naked and alone for all eternity.
You know, and they're in my office, and I'm already thinking to myself, I just can't take it, you know? And to top it off, they wanted to take the placenta home with them and bury it or something.
So she wants to squat on the floor and deliver her baby. You can deal with that.
It's her mother filling her head with those ideas.
I remember an Iranian family, similar to your Yao family in many ways. Outside the extended family, there was very little trust given to the staff or myself. They had a sort of fatalistic attitude that it was all in God's hands, that everything was predetermined. And just like with your situation, there was a mother present. There was constant arguing between the mother and the pregnant daughter. So at one of the daughter's scheduled appointments, I asked to speak with the mother alone. So how is your family?
They're fine, thank you.
You have such a lovely family.
Thank you.
And a daughter who's about to become a mother herself.
Yes, it seems only a short time before I was the young woman bringing her into this world. It is the most important time in a woman's life.
They grow up fast, don't they?
Too fast, maybe.
How do you mean?
I mean, when they grow up in this country, they forget. They forget about their family and what is important.
Do you think your daughter sometimes forgets about your family?
Yes, she does. Tasneem is an American now. She thinks she can do anything she wants. My husband, Oman, is angry, very angry with her all the time. And I find myself in the middle arguing with both of them. I mean, I'm glad she's here in America, but things are different here.
Do you miss Iran?
Yes. Back in my village when I telephone, they all treat me different now. They all think I have changed. But I've had to change. It is Oman who hasn't changed one bit.
How do you mean?
I mean, Oman tries to protect me and Tasneem by insisting that she behave like the women back in Iran. But that just isn't possible.
Tell me more about the women in Iran. Are you saying that your husband wants Tasneem to wear a chador?
No, not that. But he doesn't want her to go out without a husband. He doesn't want her to look at other men in the eye. And Tasneem wants to go to college and wants to work outside the home. It is such a mess.
Miss Gerhard, take this. It sounds like a difficult time right now for your family.
Yes, it is, Doctor.
I hope everything works out for you and your family.
Thank you, Doctor.
And I'm going to help your daughter through her pregnancy, if you'll allow me to.
Oh, I don't want any other doctor. Only you, Dr. Cornell.
I could see it wasn't time for my "this is the way we do it in America" speech. No matter how much my values conflicted with Mr. Kirhad's, they had brought their daughter to me and entrusted her to my care.
Well, I'm all for people having their own culture. I mean, if the placenta could be handled in a sanitary way, then maybe. But why go to all that trouble?
To you, it may seem unusual and a lot of trouble, but to the Hmongs, it's not. It's their way.
And what about the health risks? I'm not about to let them gamble with their health or anyone else's simply because of some superstition or some far-out practices from some third world country.
You're not hearing what I'm saying. It's not a superstition to them. Next time, maybe I can give you a hand. Maybe we can learn together.
I have to go to the hospital. I'm on call.
Well, we can go together. I have a discharge. We can talk some more.
Look, I don't need you to talk me into letting them bring the placenta home and start an epidemic in their neighborhood, okay?
Why are they always so loud? It can't hurt that much.
Mr. Diaz, I think your wife needs you. My husband was a big help to me when I had my baby.
That's her sister, Esther!
I think she wants her sister Esther to come in.
Okay, let her come in.
But he's the husband. He's supposed to help.
Mercedes, go get Esther.
Yes, doctor.
Ya, vas a estar bien. Vete, vete.
Where's he going?
Probably to a bar to celebrate. They never stay.
Mercedes, Esther, your sister's baby has gotten very large. The head is very big, and we're probably going to have to perform a C-section.
I don't think Teresa would know about C-sections. We didn't have any of those in our village in Mexico.
Do you know about her gestational diabetes?
Yes.
Has Teresa been giving herself insulin shots?
I don't know. She hates poking herself.
Has she been monitoring her glucose levels?
I don't think so. Like I said, she doesn't like poking herself.
Did you know your sister missed most of her doctor and nurse practitioner appointments?
I don't think she has anyone to take care of her 4 children at home.
Well, did you know your sister had a stillbirth?
Yes, in Mexico she had 2.
If Teresa would have maintained a normal blood sugar during her pregnancy, then a C-section may not have been needed. Her baby will probably develop diabetes now.
Mercedes, Esther, can you please explain to Teresa about the C-section?
Teresa, la doctora te va a tener que operar para sacar la bebé. Te has subido mucho de peso.
Tráeme una partera.
She needs a partera. It's a Mexican midwife.
Okay, but that's my job. We're going to take good care of her.
Yeah, better than she took care of herself.
Me van a cortar porque no ha rezado la Virgen. She thinks the C-sections because she hasn't prayed to the Virgin Mary.
No, don't let him put me, please, no.
Oh, no.
I know.
Mrs. Afi, I need to touch you in order to help you.
Maybe she's embarrassed.
She is feeling humiliation, the way you both looked when you saw the scar.
I'm sorry. I've never seen anything like this infibulation before.
Oh, when you touch her there, it reminds her of when she was a child, when she had the circumcision done.
I said so. In this country, they say you.
What is she saying?
In this country, all you do is cut the baby out.
Mrs. Lowell, your cousin's situation is very different. The scar tissue is such that...
Oh.
Mrs. Lowell, the opening isn't big enough for the baby to come out normally.
Obstructed labor can cause brain damage to the baby. She doesn't want that, does she?
Mercedes.
Please, don't change me, please. She doesn't want you to change her down there.
I'm sorry, but I think a defibrillation is necessary and maybe a C-section as well.
Then you just have to put it back.
Put it back? She likes it?
Mercedes, enough. Let's just concentrate on the baby.
You don't understand. She wants to remain the way she is now.
I'm sorry, doctor, but that's just wrong.
Mercedes, step out.
That is not wrong. It is a ritual in her family where she is from, and you will not change her.
Well, it's illegal here in the United States.
And if she has a daughter, she will have it done as well.
Oh, child welfare will be happy to hear that.
You Americans think you know everything there is to know about everything, and you know nothing about Naja's beliefs and practices.
Well, I know when something's wrong.
And you can tell that birth certificate lady outside that Naja will not fill out the birth certificate once the baby is born. The father will need a few days to choose the name.
Oh, well, that's not my job.
Everybody be quiet.
I'm sorry. Excuse me, I need a moment.
I want the same unlimited visiting hours that any father would get, not just this general visiting hours. And I want Alice's name to be on the birth certificate along with mine.
It's a long way. It's okay. Please don't cry now.
And Tasneem wants to go to college and wants to work outside the home. It is such a mess.
It's a Mexican midwife. Okay, but that's my job. We're going to take good care of her. Yeah, better than she took care of herself.
Don't say anything to me, please. I'm sorry, doctor, but that's just wrong. We're saying...
Norma? Dr. Waver, are you all right?
Dr. Cornell.
Are you all right?
I just need to get out of there. I've got a Somali lady in labor, female genital mutilation. I'll be perfectly frank with you, I've never seen anything like it. I think she's Muslim. I thought maybe you could take a look.
Well, I'm not Muslim.
No, not that. I thought maybe because you both have African roots.
Norma, I'm African American. And it's been a few generations since my family had African beliefs.
Roberta, wait. I'm sorry. I don't even know why I said that. It's just too hard. Always having to be sensitive. Trying to understand all the different cultures. It just seems like so much trouble. And then I see something like what I saw in there with that beautiful Somali woman. And anyhow, I am not a bigot. I just don't know.
There's no way we can know everything about every culture. But what's important is that we try to learn and not judge.
Roberta, I know you're right. And I'm ready to learn. Do you know anything about the Somalia culture?
No, I don't. But you might be right. The Somali woman might be more comfortable seeing a black doctor.
Well, I'm open to try anything. Because I really could use that hand right now.
Let's learn together.